You hit a certain age and you start looking in the mirror because all of a sudden gravity is not your friend. And I know because occasionally I'm doing this in the mirror and I'm trying to see what improvements are available for me. And here we are in one of my favorite places with Dr. Wrye and a dear patient of his, Cappy, and she took the leap and had some beautiful work done on her face. And so I want you to talk to me about what drove you to the decision and what kind of an experience you had here.
Well, I looked in the mirror and I could see my mother and my grandmother and
Yes.
lines, and I thought, well, I'll go minimally invasive and start with the Botox and the Juvederm. Had Juvederm in the lines here, lots of Botox up here, and I looked wonderful.
You did. I saw those photographs, and the transformation just from those two minimal procedures was amazing to me. And I thought, okay, that's a great outcome. But you weren't. It wasn't that you weren't happy, but you saw the potential for more, and so you went all the way. And doctor, what do you think? Facelifts are an amazing transformation.
Well, they are. They're a lot of fun for us because we get to see this very dramatic transformation and really positively affect someone's life. And not to get sidetracked from your original question here, but I mean, some of the exciting things with Cappy and many other patients have been some of the stories I've been hearing. You know, Cappy's been hearing stuff, you know, correct me if I'm wrong, gosh, I didn't recognize you, you look so different. I mean, just all very positive things. And I think too, the first time you came in, you said, people have been telling you look more rested.
Yes.
You know, a lot of really exciting things. And so this is all wonderful, positive feedback for me because we feel really good about what we do.
You have to, and you know what? It's so natural. And the delightful thing was, she told me that she got her dimple back, and I thought, what a beautiful thing,
Sure.
because that's something that you live with and you love your whole life. A dimple is a darling thing, and her dimple is perfect. It's
Sure.
beautiful, and that you see the improvement. The aesthetics are gorgeous. That it's not radical. It's gentle. It's natural. You know, you just look fabulous and happy, and you did that.
Well, we did, and you know, Cappy's story is, again, pretty common. You've got concerns about facial aging.
Right.
You ease into the water a little bit. You know, you've got some areas, hey, let's try a little Botox, let's try a little Juvederm, let's try some things. You start feeling good about that, and then you start thinking, what more can I do? Let's take the next leap of faith. And, you know, the reality is, I mean, Cappy is just like every other patient that we see here. You know, we do a little bit, she's happy, we do a little bit more, and look at the results. So
It is totally amazing. And what does your husband think about this?
My husband thinks I look 15 years younger. I look in the mirror and I don't see the dramatic change because I'm looking at this mug every day. But he Friday, we were going away for the weekend, and he said, you just look beautiful. I had just put my makeup on, and that makes me feel wonderful. Thank you, sir.
You're
very
welcome.
much.
It's my pleasure.
And that's a change. You can't put a value on that. To feel, at our age, to feel that great about who you are and yourself, and to have, you know, everybody's in love at this age, and you want someone to appreciate that, you know, you're still the beautiful girl he married.
For years.
That's awesome. That's so impressive. But the thing that impresses me the most is that it's a correction of the problems that she was experiencing from aging and just from gravity. You look beautiful. It looks natural. There's nothing that anyone wouldn't be so happy and so delighted with. And I love this guy because I know great stories about him that are phenomenal reconstructions for people. So not just plastic surgery, all kinds of great stuff is done here with our friends here at Dr. Hall and Dr. Wrye. Cappy, thank you so much.
Thank you.